Hello, this is my video presentation on the drug Theophylline. My student number is 3249841. I will be covering the pharmacokinetics, mechanism of action, and some other considerations about the drug. Theophylline is a drug used as an add-on therapy, a second or third medication to control and manage asthma and chronic obstructive pulmonary disease, or COPD for short. Theophylline belongs to the drug class xanthines. The drug's mechanism of action has limited research, although it is believed that it causes anti-inflammatory effect and bronchial dilation. The therapeutic range for theophylline is 10 to 20 micrograms per ml. This is a small range. It is important for this drug that we have correct doses. Theophylline is taken orally, either a tablet or syrup. The syrup is mostly used for children and the elderly. Keep in mind these figures are for adults. It does change considerably for neonates and the elderly. The medication is absorbed via the stomach and small intestines at peak levels of 4 to 6 hours, with a varied half-life of 3 to 12 hours. Due to the long half-life, this medication is mostly used to manage and is not used as emergency medication to treat an acute asthma attack. Theophylline metabolizes via the liver, mostly by the liver cytochrome P450, which is an enzyme that breaks the medication down where it is filtered into the blood by the liver. It is then distributed via plasma, where 50 to 70% of the drug binds to the plasma proteins. Finally, 10% of the whole dose is excreted via the kidneys. Theophylline, as explained previously, has limited information on the exact mechanism of action. The first being phosphodiesterase inhibition. Theophylline inhibits phosphodiesterase enzyme, which is an enzyme that breaks down cyclic nucleotides such as CAMP and cGMP. Therefore, the inhibition of phosphodiesterase increases CAMP and cGMP. When these cyclic nucleotides are increased, several outcomes occur to cause vasodilation of the vessels. One is the reduction in calcium in the blood, which interferes with the contractility of blood vessels, therefore leading to the relaxation. Secondly, theophylline can cause bronchial dilation. Many medications used for asthma and COPD are bronchial dilators. In high concentrations, it is believed that theophylline inhibits adenosine from attaching to A1B and A2B receptors on mast cells within the areola in the lungs. This inhibits the production of substances such as histamine and protenoid, which contribute to smooth muscle contraction within the lungs. Therefore, inhibiting adenosine will cause the opposite effect of relaxing the smooth muscle within the lungs, allowing for an increase of gas exchange. It is important with theophylline to consider the counselling points during practice. Tablets cannot be crushed or chewed as they are intended to be absorbed in the stomach and small intestine. Decreased liver function, thyroid function, heart problems, pulmonary edema, fluid retention, hypoxia, decreased oxygen in tissues are all some causes of decreased drug clearance, which means that the medication will take longer to process in the body. It is important to understand this before giving the medication. Patients that smoke will have an increase in drug clearance. Due to the therapeutic range being small, it is important to monitor plasma concentration of the drug to limit toxicity. As this medication has a strong effect on dilation of the blood vessels and the relaxation of muscles, it is important to understand a patient's cardiac history. Some common adverse reactions include headache, insomnia, anxiety, irritability, and seizures. As uncommon, this is caused by increased neural activity from the drug. It is common to get palpitations, uncommon to have arrhythmias and tachycardia. This is because the drug stimulates the heart, and finally it can cause GI upset such as nausea, vomiting, diarrhea, reflux, due to the irritants towards the stomach lining. Theophylline tablet form is a Schedule 4, meaning it is prescription only, therefore requiring either a medical practitioner or nurse practitioner to prescribe. The syrup, however, is a Schedule 3. This can be prescribed by a pharmacist. This is because the strength is smaller. When giving or prescribing this medication, it is important to gain informed consent due to the high risk of toxicity. From the small therapeutic range, it is also important to understand the patient's history, as this medication has several interactions with other drugs and is in most cases not used as a primary medication. Finally, as a part of gaining consent, it is important to inform the patient about the potential side effects. Thank you for listening to my presentation. I have prepared a small quiz to test your knowledge.